Hi, my name is Dr. Steve Spitzer. Welcome to the Eye Consultants of Syracuse. This video is designed to give you insight into your upcoming experience with cataract surgery. It is not meant to be an informed consent, nor is it complete in discussing all the risks of surgery. An informed consent will be conducted at the office. A cataract is a clouding of the natural lens of your eye. The lens sits behind your iris, or the colored part of your eye, and is surrounded by a shell similar to an M&M. It is attached to your eye by multiple surrounding tethers. The tethers are similar to the springs of a trampoline. A cataract can cause colors to be dim, lights to have halos and glare making driving difficult, small print to be blurry, and depth perception to be off. Often a change in a glasses prescription can help to improve these symptoms. However, if new glasses can't help or don't help, then surgical removal of your cataract is indicated. Advances in technology have made cataract surgery very safe. But like any surgery, there are risks involved. These include infection, inflammation, swelling of the cornea or retina, retinal damage, incomplete removal of the cataract because of a defect in the support system, and a second procedure to treat any of the above. After you and your surgeon have decided to proceed with cataract surgery, the journey begins. You will be scheduled to see your primary care doctor and or your cardiologist in order to be cleared for monitored anesthesia required for the surgery. Your doctor will likely need to order blood work and an EKG to assess your anesthesia risk factors. You will also be scheduled to return to our office in order to sign a consent form. The consent form will review the risk factors previously mentioned. In addition, you will have the opportunity to ask any further questions you may have. Included in this visit are measurements of your eye so that your surgeon can select an appropriate power for the lens inserted in your eye. In today's era of cataract surgery, there are different choices of lens implants from which to choose. First is a standard lens, which has one function, and that is to correct your vision for distance. If you have astigmatism, you may need glasses to sharpen your vision. Reading glasses will also be required. If you do have significant astigmatism, then you may decide to have a special implant called a toric lens, which helps to lessen the astigmatism, which can help to decrease your dependence on glasses at a distance. Reading glasses are again required. If you are interested in reducing your dependence on glasses at a distance and for reading, then you may decide to choose a specialty lens. These lenses distribute light so that your range of vision improves without glasses. Reading vision, computer vision, and distance vision may be possible without the need for glasses. Not everyone is a candidate for these special lenses, and insurance does not cover the full expense requiring out-of-pocket money from the patient. Discussions with your surgeon will identify appropriate patients for this technology. The surgical procedure will be viewed shortly, but let's go through the process on the day of surgery. You will arrive at the surgery center at your designated time. After being admitted, you will sit in the preoperative area where you will receive eye drops to dilate your pupil. When it is time for your surgery, you will be transported to the operating room and placed on a stretcher so your eye can be prepped for surgery. The surgical procedure begins with a small incision on the side of your eye. Gel-like material is injected in your eye to keep its shape during cataract removal. A second incision is made, which is slightly larger. Then, a cut is made in the shell that surrounds your cataract and torn in a way to create an entryway to the lens. Fluid is injected inside the shell to separate the lens from the shell. It is then rotated to ensure its complete separation. A vibrating probe is placed in the eye. This probe breaks the cataract into small pieces. A second instrument is inserted in the eye to facilitate this process. Once the cataract is broken into smaller pieces, they are then vacuumed into the probe and out of the eye. A second probe, which is smaller, is used to clean up any remaining cataract material. This material is often softer and stickier than the original cataract material. Patience and care are taken to ensure the complete removal of this material. More gel is injected into the eye to make room for the lens implant. The implant is then injected and rotated into proper position inside the shell. The small probe is then reinserted inside the eye to remove the remainder of the gel. The incisions are hydrated to enhance closure, and the procedure is over. This is a pictorial display of what you've just seen by video. You are then returned to the preoperative area where you are given something to eat and drink. Postoperative drops are also reviewed at this time, as are other postoperative instructions. Thank you for choosing the surgeons and eye consultants to care for you. I wish you the best in this experience. Please do not hesitate to contact us with any further questions.